Hi everybody, this is a video about how I approach managing flare-ups. Somebody posted this question on one of my other videos, so thank you for the question. As per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only, and if you need medical advice, please talk to your clinician to obtain said advice. So flare-ups are just crummy. It really sucks when people are having flare-ups. It's terrible for the patient, and quite frankly, it's not fun for the clinician either, because we care about our patients, we want everyone to be doing well, but sometimes as treatments are being implemented, whether it's a detox protocol, an antimicrobial protocol, or what have you, then sometimes detox or flare-up symptoms occur, and then of course just sometimes symptoms get worse for various reasons. Somebody overdid it, or a disproportionately large number of folks flare up when there's a full moon. Sometimes they flare up when there's a new moon. There can be flare-ups around certain times of the menstrual cycle. There are just a number of different things that can cause flare-ups. So it's a great question. What do we do to manage those flare-ups? So there's not just one answer to that question. There's not like a top three that might apply to everybody. It really depends on the case. And if there's something more cyclical that's happening, like say, premenstrually, there's always a big flare-up. Well, in that type of case, what I would typically do is talk to the patient about implementing some treatments to help try to better regulate their sex hormones, so that there's it's going to be less likely to flare around that time, where we might use some hormone low-dose immunotherapy to help mitigate symptoms around certain times of the menstrual cycle, for example. Or if there are flare-ups happening when we're building up, say, the dosage of an herbal tincture to help kill off Borrelia or Mycoplasma or Bartonella, then I would definitely in those cases recommend for my patients that they either take a break from the herbs until things settle, and then we build it up more slowly, or they'd reduce to a previous dose that hadn't been flaring, and then wait for things to settle and then build up more slowly. I know that some clinicians recommend that patients just muscle through die-off reactions, or Herxheimer reactions as they're called. I'm the polar opposite of that. I personally feel that in my experience that's typically counterproductive and just very unpleasant for patients, although there are maybe some exceptions to that that are out there. So sometimes it's just a matter of modifying the protocol, and then there are certain treatments or therapies or interventions or supplements that can sometimes help to mitigate flare-up symptoms. So for example, if someone's starting on a detox protocol, actually had a patient recently who went to a health food store. They wanted some immune system boosting support. For one reason or another, they were recommended to take this herb called cleavers, which is something that is generally used to help get the lymphatic system moving. And they had like a major reaction to that. And it's like, oh, based on the reaction that they had, it seemed like a big histamine dump. So in that case, to minimize or to mitigate that flare, then I was recommending mast cell stabilization support in the form of quercetin, recommending some Reactin, also known as cetirizine, also known as Zyrtec for anyone from the States who's listening. We call it Reactin here in Canada. And so in that case, it was a flare that was due to, I was able to kind of trace back what was the physiological mechanism behind the flare, and it seemed like, it was a mast cell activation thing, even though it was due to it seemed to be due to a lymphatic support protocol that was too aggressive. There are also there are a few things out there that are kind of purported to be tried and true flare mitigators, more in the realm of detox flare mitigators. That would include things like enemas or coffee enemas, using a sauna, doing dry skin brushing. Some people take these things called tri-salts. Some people find that baking soda baths are helpful. Some people find apple cider vinegar baths are helpful. Sometimes people find that taking certain detox support like homeopathics or homotoxicological formulas are helpful. There's this stuff out there from the company Nutrimetics called berberpanella, which some people find to be really helpful. Some people do well with more like energy-based medicine, things like Rife machines, or there's something out there called an amp coil. There's things called bioresonance machines. Lots and lots of different things out there. What I've found is that in my practice, it's usually the most effective to when a patient's having a flare-up, try to figure out why the flare-up is happening, and then work with the right types of supports to try to mitigate that flare-up. So as I was saying, up to this point, it's kind of nuanced and individualized, but that's really the best way to look at kind of looking at the mechanism of why is the flare-up happening, and then working to try to rectify that. And sometimes, if it's say there's a big pain flare up or something, maybe just taking some anti-pain medication, like taking some ibuprofen or Tylenol or what have you, if that's appropriate for a given case, or other pain management meds, or if people do well with things like frankincense or curcumin or PEA or different natural substances that have anti-pain mechanisms, like whatever works, that's great. So yeah, not a very straightforward answer, but it's really just not a straightforward topic. But I hope that gave the asker the insight that they were looking for. So thank you again for the question. If anyone has any questions about this topic or anything else, just post it in the comment section below, and I will leave it there for now.